All right, I think this is everybody for us. Awesome. Oh, you can introduce.
So you guys have all had a chance, I hope, to meet Mallory. She's just a joy for us to work with in Special Olympics. Here's a little bit of her background. She's the health and fitness director for Special Olympics Montana, a role she's held for 2 years. She earned her degree in exercise science and health promotion at the University of Idaho. Mallory chose to work at the Special Olympics Montana because of her passion for promoting inclusive health and fitness opportunities for people with intellectual disabilities. She's dedicated to making a positive impact on the health of athletes by fostering a supporting and empowering environment. And I'd like to add one more thing that's not on this list. At a recent Special Olympics event, the Healthy Athletes event, she brought her children, and I thought there's no way better to teach inclusive health than to practice it in front of your own kids. And the children were joyful, happy, dressed up like fairies, running around and helping us. And I just applaud you for that, because that's a scary thing to do, but it was beautiful.
Thank you, Mary. They just attended state basketball as well, and they had a blast. So, all right. So, like Mary said, I'm the health and fitness director for Special Olympics Montana. I will really just leave it at that. I'm going to turn it over to our panel, our co-facilitators. I'll start with Vicki.
Yes, good afternoon. I'm Vicki Donisthorpe, and I'm the Chief Operating Officer for Special Olympics. I'm actually taking DJ Jackson's spot because he wasn't feeling well. He's one of our athletes, so apologies. He's much more interesting than I am, so I'm going to do my best to be his substitute today.
Awesome. Thank you, Vicki. Thank you so much for being here. And Hillary, would you like to introduce yourself?
I'm Coley.
I'm Stacey Johnston-Gleason, and I've been in Special Olympics for 40 years, and I'm with the Lake County Screaming Goats.
Lake County Screaming Goats. And Hillary, do you want to share how many years have you been involved in Special
I've
Olympics
been
in your
in
team?
Special Olympics for 39 years, and I am from the Missoula Diamondbacks.
Great. Coley.
I'm from Missoula Diamondbacks. I've been in Special Olympics for 10 years.
Awesome. Thank you three so much for being here. All right, we'll get started. Oh, see, I gotta go back and forth over here. So here's Stacey's photos. Thank you, Stacey. A little bit on Hillary here. And then Coley. All right, you guys. So our agenda for today is learning about Special Olympics, learn about intellectual and developmental disabilities, or IDD, as we're all aware, learn about health disparities for people with IDD, learn about Special Olympics health initiatives, and how to become a part of the inclusive health movement. And we're going to start it off with Stacey. Do you want to share the background of Special Olympics?
Yeah, in the 1950s and 60s, John F. Kennedy's sister, Eunice Kennedy Shriver, saw how unjustly and unfairly people with intellectual disabilities, or IDD, were treated. If you didn't know, she had a sister, Rosemary, who had an intellectual disability. So she was quick to see how people with IDD were treated. One of the things she noticed was that many children with IDD didn't even have a place to play. She decided to take action, and she held a summer camp for young people with IDD in her own backyard. In 1968, the first Special Olympics International Summer Games were held in Chicago. About 1,000 athletes with intellectual disabilities competed in over 200 events. Here, Eunice Kennedy Shriver gave a moving and dynamic opening address, which included what became the Special Olympics Athlete's Oath. Let me win, but if I cannot win, let me be brave in the attempt.
Thank you, Stacey. All right, so today that backyard camp has grown into the world's largest sports organization for people with intellectual developmental disabilities. So with more than 5 million athletes of all ages from over 170 countries, competing in over 30 sports, and including more than 1 million volunteers. Hillary, can you tell everybody the mission of Special Olympics?
The mission of Special Olympics is provide year-round sports training and competition in different sports for children's and adults with IDD, gives them a challenge to drive. Fitness shows courage, shows joy, and share gifts and skills and friendships with their families and other Special Olympics athletes and in their community.
Great. Thank you, Hillary. All right, we're going to talk about eligibility for Special Olympic athletes. Let's see this one. Coley, how can one participate?
To become a Special Olympic athlete, a person must have an intellectual disability or a cognitive delay. So let's define intellectual disability.
Good, thank you. So as you guys can see on the screen here, we have two definitions. So one is from the American Association on Intellectual and Developmental Disabilities. It states that intellectual disability is a disability characterized by significant limitations in both intellectual functioning and in adaptive behavior. The disability originates before the age of 18. I see that one is just flashing over there. The World Health Organization, so second one, defines intellectual disability as a significant limitations in intellectual functioning, significant limitations in adaptive behavior, and manifestation of these symptoms before adulthood. So both of these definitions state limitation in intellectual functioning and adaptive functioning originating before the age of 18. Yeah. So they can still participate. Is that what you mean in Special Olympics? Yeah. Mm-hmm. I think Vicky has this one.
And actually, that's a
Great
really good question because we actually, for Special Olympics, it starts with our young athletes, then it goes to school age, all the way up until graduation. Then after graduation, it goes to, we have what we call community adult programs. And it can go into the 70s, 80s, as long as people want to participate. That's a really good question.
Thank you for asking that. All right, you guys, so next one is adaptive behavior. So we're just going to briefly define what that means. Adaptive behaviors fall into 3 skills. So they're conceptual, social, and practical skills. So if you don't know conceptual skills, those include language and literacy, along with money, time, and number concepts. Social skills, those include interpersonal skills, social responsibilities, self-esteem, social problem solving, and the ability to follow rules. Practical skills, this includes activities of daily living or personal care, occupational skills, travel, transportation, schedule or routines, and safety. So intellectual disabilities fall within a wide range, and therefore a provider's approach to communicating and working with individuals with IDD and their families will vary depending on where that person falls into that range.
So who are the people with intellectual disabilities? Although we've given you these great definitions, we need to just remember that people with IDD are our neighbors, they're our family, they're our coworkers, they're our community members, and of course, they're Special Olympics athletes. And by the way, I'm sitting next to 3 very fierce Special Olympic athletes that they train, they compete, and they're athlete leaders across the state. So, and as you know, they work in our communities, they're contributing to our community, and they're leaders.
Good, thank you, Vicki. So if we just think about our own lives, so what are some conditions that need to be in place in order for you to exercise, work, participate in the community, be active, etc.? One condition that is huge is good health. So one needs to feel good and have good health in order to be involved and successful in our jobs, our community, our family, and our life. So we're going to look at the next slide and learn how this condition for individuals is with IDD. This one is Coley.
Oh,
Oh.
no, it's Stacey.
Stacey.
Individuals with IDD typically do not have the same access to health care. when compared to neurotypical people. Oftentimes, medical providers are not properly educated or equipped with proper skills and tools to treat individuals with IDD. With that being said, people with IDD do not get the proper health care they need and deserve.
Thank you, Stacey. So on the slide here, I'll just do a little quick overview. So for every 10 athletes on a U.S. Special Olympics team, 8 are obese or overweight or obese. 7 have significant problems with flexibility. 4 out of the 10 need a prescription for eyeglasses. 2 have some kind of eye disease. 3 will fail a hearing test. 3 have low bone density. 3 have untreated tooth decay. And 1 needs an urgent referral to a dentist. All right, Coley, you want to share the next 2 slides?
To give you an idea of what life can be like for someone, Special Olympics athletes, imagine that you're on a basketball team with this athlete. You are passing the ball. Do you think he should be able to catch the ball and attempt a shot? Have you ever thought that maybe this is what the athlete sees when you pass him the ball? Maybe. This athlete has never had his eyesight checked. 1 in 4 of our athletes need new glasses, and 2 out of 10 have never had an eye exam.
Thank you, Coley. And I think Stacey's going to share a personal story on your eyesight.
When I was in high school, I had no idea. Hadn't been able to see my entire life. So I got my eyes checked. I was almost 18, and what the doctor said was, "How do you get around?" And when I put in contacts, I was amazed that I could see color for the first time. I saw red. Red was the most vivid thing I could see. And I was just like, I am never taking these out of my eyes. I was just like, I just was walking around. I was just so amazed. And I'll never forget the color red.
Yeah, red was significant to you, wasn't it?
Yeah.
Yeah, it was. Well, thank you so much for sharing that. All right, we're just going to keep moving along. So people with IDD and their access to health care. All right, Hillary, do you want to share this slide?
Unavailable when, what? On average, when students age of 18, 44 with IDD, and 1 in 4 do not have a provider. 1 in 4 does not have health needs because of cost in the past year. 1 in 5 do not have a checkup in the past year.
Good, thank you, Hillary. All right, so this one goes hand in hand, this one. Ooh, fancy one, health disparities. So people with intellectual and developmental disabilities, we're going to talk a little bit about our health disparities. Stacey, do you want to go over that one?
People with IDD have an increased prevalence of diabetes. In fact, some studies suggest that this could be as much as 5 times the prevalence rate of the general population. Additionally, people with IDD are 3 times more likely to have arthritis, 2 times more likely to have cardiovascular disease and asthma, and on average die 16 years earlier than the general population. I don't know about you, but the last statistics really gets my attention. A person with IDD on average will die 16 years earlier than their peers of the same age. This is something we need to work to change, and it is something that drives our programming, our health programming at SOMT.
That's right. Thank you, Stacey. So generally, these deaths are not because of conditions that are biologically associated with IDD, but because of other factors. Like a lot of us in this room know, but inadequate access to good healthcare, underprepared healthcare workers, and a lack of policies or systems in place that protect the health rights of individuals with IDD. So it's important to note that many of these factors can be improved through health education and adjustments in lifestyle. So due to these facts, many people with IDD are at higher risk related to inactivity and lack of fitness. All right, so the causes of health disparities. Coley, do you want to share those?
Limited prevention programming, lack of provider training on how to meet health needs, diagnostic overshadowing during exams, lack of knowledge, skills, and resources for providers, prohibitability complex health systems that restrict access.
Good, thank you, Coley. So barriers to good health. Sure, good question. So diagnostic overshadowing is if a person with IDD goes in for an exam and they're totally overlooked, a symptom that they're having in their mouth or symptom maybe in pain in their leg or something like that. The doctor overlooks that and just assumes that it's because of their IDD. So they're really not looking into what the cause problem is. Go
Not
ahead.
having good conversations,
Mhm.
asking those questions to draw it out to, really get to the bottom of what the symptoms are. And Stacey, you talked about that even
Right.
I believe yesterday when we met. You were talking about the one doctor that asked you all the right questions to draw out the diagnosis. That was
Mhm.
very important.
Yes.
Right? Or provide an example when you say lack of training and curricula on how to meet health needs. What do you mean by that?
Yeah, so I'll get to that, but we have our inclusive health trainings. So that's primarily we focus on universities, nursing students, dietitians, health sciences, where we go to the university or virtually, try to reach as many people as we can. But those going into the health field, being able to communicate with those that have IDD effectively. So we do see that. So that's kind of what we strive for in the health at SOMT, but I'll go through that again. I think that answered the question. Did that answer the question? Yeah. Yeah. Mary's going to add something here. Oh, go ahead.
Sorry, the interpreter can't hear you. Oh, I'm sorry.
So Special Olympics International now has an e-learning platform where health professionals can access a whole series of modules that train on specific things, like what is an intellectual disability, and going through all the different reasons why a person might have an intellectual disability, what their life expectancy is, what their capabilities are, all the way down to communicating with. And they're designed for healthcare professionals. They'd be perfect for dietitians, nurses, doctors, pharmacists. And we can get you those links. There's no charge, and they're done by professionals throughout the world. They're very high quality. So to address the exact things that the athletes are describing.
Thank you, Mary. So another question?
I just had a question about, and you might answer it, which is kind of like liaisons. Like, are there liaisons or people are, or do you have any examples of liaisons that are working like between a practitioner and the person who is going in to receive care?
That's a good question.
It's a really good question.
Does Meg?
I'm not sure at Special Olympics if that kind of is beyond our reach and what we do, but it's a really good question. So basically, do they have a mentor or somebody with them to help advocate? Let's ask our athletes.
Sometimes my mom goes. If it's an appointment that's,
Mhm.
an important appointment. If it's just a general appointment, she won't. But if it's something that's like really important, then they'll go.
Mhm.
The same with my parents, like if it's a really important appointment, they just come with to help me understand what's going on with me.
Mhm. All right. So you were asking if we had like a specific health person from SOMT in a position to go. I don't think so. Mm-hmm. Right. Yeah, very. Mm-hmm. Right. Did you want to add something, Meg? Here.
Yeah, I think that's a really important point. I think that one of the programs that um, our family to family program is working on is putting family advocates, paid family advocates in our pediatric clinics. And that's not an easy role to keep in place. It's such an important role. And community health workers, I think I've heard people talk more about having um, patient advocates who are, but if you have some ideas, Kai, things that you're seeing in your community that we could be thinking about building out more inclusively, that would be great.
My question, I guess, is I hear a lot about intellectual development and disabilities in Special Olympics. What about physical disability? Are there, are
It's a very good question. So the qualifier to get into Special Olympics is an intellectual disability, but many times our athletes might have something physically that there's an impairment there. And so that's where our adjustments come in. Like, for example, recently at our state basketball tournament, we have everything from skills and adaptations for that skills level competition to 3-on-3 to 5-on-5. Bowling, same thing. We've got all adaptive ramps and so, yep, we try to adjust as we go.
great? I just hadn't heard about physical.
Yep.
disabilities.
Yep. Thank you. Good question.
Yes, thank you. Got a new mic, can hear me. All right. All right.
All right, we're going to continue on with barriers to good health. So, and I think these were actually touched on earlier, but so we'll quickly touch on them. So attitudinal barriers are those misconceptions that people with ID cannot live long and healthy lives. That is so not true. Social barriers, that the conditions in which people are born, grow, live, learn, work, and age. Programmatic barriers, that's that failure to make reasonable accommodations for people with IDD. Also physical barriers, that's that structural challenges that block mobility. And then last but not least is communication barriers, that use of complicated, inaccessible language. And so we believe that all of those changes, we could play a part in reducing those barriers.
Good, thank you, Vicky. Okay, so for the next 3 slides, we have real scenarios. So we'll just talk about the reality of these barriers that mean for people with IDD. Okay, so I think I have this one. Yeah, so can you guys hear me okay? A 35-year-old with IDD goes to the eye doctor every year. She can't participate in the eye exam because she can't read the letters on the chart. The optometrist doesn't know how to provide her with an alternative test, so she is considered legally blind and never provided eyeglasses. And Hillary will share this next one.
If a 54-year-old person with IDD cannot make an appointment with a healthcare provider, because many providers do not have them in their area, do not accept Medicaid.
Good, thank you, Hillary. So last one here. A teenager who is nonverbal with IDD begins having violent episodes and is placed on antipsychotics because no one ever looked in his mouth to discover multiple abscesses. All right. Yep, so here's 2 statistics for everyone. Vicky will read these ones.
So 34% of our healthcare professionals report that their professional education didn't quite prepare them enough to work with people with IDD. And in a global survey of the general population, 52% of the respondents agree that people with IDD are capable of describing their health symptoms to a doctor, but many times it just takes longer and it takes really good questions. So what I'd like to share with you today too is a little bit of feedback from Josh Anderson, who's a Special Olympics athlete that works in our main office. So one of our employees at Special Olympics, he's an athlete, he competes, and he's in our office daily working. So when we asked Josh about that, he brought up some advice for any of you that might have a coworker that you work with. He says, just remember, I personally do better with yes or no questions, or if the questions can be narrowed down to a couple choices. Otherwise, it can become too overwhelming. He also shared, I like it when I am treated just like anybody else, when we have jokes, and Josh is a real jokester in our office too. And when I may not get a joke, he says, I do like to talk and may get sidetracked, but please know that I just need more time. Time when you ask me questions, time when I have to evaluate a condition or a problem. Josh also shared that I prefer to make decisions for myself. So for me to understand what my choices are, sometimes that means making choices by giving me a chance to think about them and then think about what the consequences are. Most recently, Josh served on a interview committee with us. And so we'd never done that before. And Josh actually went through the interview process. He got to ask questions, and then he got to narrow down and nominate. He got to give input on who he thought the top candidate was. We were pretty excited. He did a fantastic job. So Josh said, don't ever forget to give us written directions. It's really nice to have something written down so that we can refer to it. Cursive writing is always hard to read. Simple print is always best. And that also, please keep me informed. Please keep all our athletes informed. Please talk to us. Sure, use eye contact with us. Be confident, and don't be afraid to ask us questions. It's not so scary after all, Josh said.
Thank you, Vicki. And I've had the pleasure to work with Josh quite a few times for our inclusive health trainings that we do at certain universities. So he presents with me, and so we share that story quite often. So I think it's very powerful. So thank you. All right. So we're going to start talking about solutions, inclusive health. So the goal of inclusive health, I think this one is on Stacey. Go ahead.
Inclusive health means people with IDD are able to take full advantage of the same health programs and services available to people who do not have IDD. Our goal is to improve access to quality health care for 11 million people with IDD. When people with IDD have access to health services, they also have more opportunities for education, employment, sports, and other pathways to reach full participation in society. Impaired coping abilities and limited communication skills, common among people with IDD, can mask health concerns. This can lead to a breakdown in the quality of healthcare and health education for people with IDD.
Good. Thank you, Stacey. I think this one kind of goes hand in hand. So another solution here. So Special Olympics, of course, is always improving the health, or want to improve the health of people with IDD. So Coley, if you want to share these first two, that'd be great.
Prevention through our young athletes programs, fitness programs, and family health forums. Assessment through our Healthy Athletes program, care coordination, and close the referral loop.
Good. And these last two, I'm going to read up from up here, is training and advocacy. So training is training of health professionals, like we've talked about, ensuring they have the skills needed to care for people with IDD. And then health equity, that last one there. So inclusive health, funding and policies to ensure people with ID can have access to appropriate programming and services the same way with those without ID. All right, so what are some other solutions, Hillary, specifically from Special Olympics Montana?
The solution is our year-round health and wellness programs and competition and competing and competition and at sporting events is not in, what? Not enough. As you see on the bottom of the side of our motto is to be a good athlete, you need to be a healthy athlete. I love to go on walks, going hiking with friends, and I do lots of fit classes, and I really enjoy yoga.
Good, thank you, Hillary. Yes, I was going to ask her, how does she keep moving and exercise? So loves to take walks and hike and do yoga, so good for you. All right, so we're going to dive deep into specifically Special Olympics Montana now. So healthy athletes, so this is one of our main programs. By now you've probably heard of it. Tom talked a little bit about it. So this was launched in 1997. Special Olympics Healthy Athletes Program has conducted more than 2 million free screenings in over 135 countries, with over 220,000 healthcare professionals and students receiving training. So specifically in Montana, we have been offering the Healthy Athletes Program since 2007. Since then, SOMT has conducted more than 15,000 screenings, with over 50 clinical directors receiving area-specific training and over 650 volunteers educated. So as you can see on the screen, we have 8 disciplines. So there's Fit Feet, so that's podiatry screenings. We offer Fun Fitness, those are the physical therapy screenings. Health Promotion, so better health and well-being, and we'll talk a little bit more about health promotion after this one. Healthy Hearing, Audiology, MedFest, those are those free sports exams. Opening Eyes is the vision screening, and Special Smiles, dentistry. And last one is Strong Minds, emotional well-being. And for the first time ever, we've just offered Strong Minds at our state basketball tournament in Helena last week. So proud to say that we got a clinical director for that. And it all turned out really great and very busy. So I think the athletes liked that one. It was something new to add for us. So let's see, on the clinical director topic. So each one of these, we must have a clinical director. Obviously, we're volunteer based. And so always looking for more clinical directors for each of our disciplines. So when we do offer our screenings, we don't necessarily offer all of them at once. We try to switch them up. So last week we offered 5 of them. At State Summer Games, we hope to offer Opening Eyes and a couple others. So we haven't confirmed those yet, but that will be in Billings. So we're alongside our competitions, I guess is what I'm saying. All right, so specifically Special Olympics Montana.
Right, so for Montana, Healthy Athletes established in 2007, conducted, there have been over 7,500 health screenings. Currently, Montana has 31 clinical directors, and we have over 2,700 participating athletes.
All right, so health promotion is one of those 8 disciplines. So since we're here, obviously talking about inclusive health and nutrition, I just really wanted to touch on health promotion. So health promotion has 4 key areas, as you can see on the screen during the screening. So that's BMI, so based on height, weight, and age, waist to height ratio. Third one is bone density screenings, and 4th is blood pressure. This one, I pulled together some data about health promotion. And so we've been offering it since 2007. Number of screenings, 1,577. And then individual screened for health promotion was 1,182 individuals screened. So I gathered up 3 categories here, and these are all referrals since 2007. So lots of data all compiled in these little tiny graphs. But as you can see, blood pressure is 30, go to my notes here. 30.5% of our athletes received a referral for blood pressure. And so these bottom numbers are their ages. So you can see 16 over is the highest there for the blood pressure. Middle graph, 60.1% of our athletes received a referral for high BMI. And 36.6% of our athletes received referrals for low bone density. All right, so I think we have time. It's just a quick video about health promotion, including, and you'll notice a couple of people in the video that are in this room. It's a little overview about health promotion in general.
Everyone can learn from health promotion and health habits. It changed my life to work with a new population and to be able to give back.
It's a positive opportunity. The information we provide and the skill development that we work on with the athletes really does become part of their lives.
I was working with the children with disabilities, all disabilities, at these special schools. And somehow nutrition took a backseat. I was approached by Alice Lenehan if I would be interested in work as a volunteer in India for their programs. And of course, I agreed immediately. Health promotion is essentially looking into the general health and well-being of the athletes, making them aware of it also, and of course, screening them and providing referrals. When you see the athlete, what a change in their lives this whole movement brings. The kind of inclusion it brings in, it's just fantastic. When the volunteers come in, they are so motivated and so enthusiastic about it.
I think this is great education for our athletes to understand their performance and realize that if they stepped up their game in nutrition, that they could step up their game on the court, which would be great. And also just long-term health, that they can just take care of their bodies.
For me, I didn't even know I had low bone density until I went over there. My blood pressure was a little bit better, like perfect, as opposed to how it's been. So that's good.
Thank you for your interest. Your experience will be rewarding and will change you forever.
I also challenge you to talk to your colleagues, your friends, anyone who will listen, that it's important to step up to the plate and volunteer for Special Olympics. I promise it will change your lives and you will impact the lives of everyone that you work with.
I just love that video. So thank you, Mary. You don't remember, that's funny. So yeah, health promotion is definitely one of our more extensive screenings that we offer, along with fun fitness. So those four concepts that I did show earlier, it's, you know, definitely not just the height and weight and blood pressure. We talk about tobacco cessation, sun safety, you know, healthy eating, my plate, just really try to give them that overall health and well-being. So, all right, we'll go back to share. Takes me right there. All right. We're going to switch over and just do a little overview of MedFest. So this is one of those 8 disciplines. All right, this is on Stacey, I think.
MedFest screenings have found that a large percentage of Special Olympics athletes have significant health concerns that are preventable and or treatable. The goals of MedFest include a free sports physical and other health examination services, recruit new athletes to Special Olympics, foster new partnerships between Special Olympics and the community, and provide physicians, nurses, and other healthcare providers with training and specialized experience in caring for people with intellectual disabilities.
Good, thank you. So the one on the pictures you guys can see here on this slide, just wanted to highlight our MedFest from last summer. So this was in Helena. This MedFest, we brought 2 disciplines together. So we typically do that. So MedFest was Special Smiles. In this case, 20 athletes were screened and we're now ready to participate in competitions. So this was Westmont and Spring Meadows. So they were reactivated. So it was a huge success. All right, so next few slides are about our fitness programming. All right, Hillary.
Special Olympics encourages people with IDD to learn in life and fitness through exercising, health, eating, and drinking lots of water. We have a program called Fit 5 to do just that.
That's right. Thanks, Hillary. So our Fit 5 classes, so besides healthy athlete screenings, we try to offer a variety of fitness programming for our athletes because like Hillary said earlier, competitions are just not enough. So part of my job is offering these Fit 5 classes around the state of Montana, along with other creative fitness challenges, virtual or in person. Just specifically on Fit 5. Coley, what are these 3 goals for the Fit 5 classes?
Exercising 5 days per week, eating 5 total fruits and vegetables per day, drink 5 bottles of water per day.
Good. Got a little bit more on Fit 5 here too. Some fun pictures wanted to share. So just want to highlight the peak for Great Falls up there. So we tend to have quite, there's a pretty good base that we have with the peak at Great Falls. So we offer our Fit 5 classes annually with them. They've been so generous in opening up their facility for us. Also YMCA Bozeman, so down there. So it's not just about, exercising. It's a huge part is the instructors. They share, they're doing sorting out vegetables and fruit, I believe, in the bottom right photo, and then going over the My Plate. And then just wanted to highlight the CrossFit in Billings. This was something new that we haven't done before, integrating CrossFit with our Fit 5. So that's strength training along with our Fit 5. And then Hillary and Coley, we're going to go over what a health messenger is in the next couple of slides, but these two are health messengers, and so they had to do an activation or a practicum to become a health messenger. So they're going to share a little bit about what each of them did for their practicum at the end of their 8-week training. So I think I have Coley first. Oh, Hillary, either one.
I choose to give a health talk at each session of the Summer Fit 5 Walking Club at Playfair Park in Missoula this summer. I shared information about exercising 5 days a week, nutrition, eating 5 fruits or vegetables a day, and hydration, drink 5 bottles of water a day.
Mm-hmm. Good.
I put on a walking class in Missoula. I worked with Audrey, the teacher of the summer walking program. 2 law enforcement run officers joined the fun as well.
Awesome. So those sound like they were fun practicums. I wish I could have been a part of those. Well, good for you too. All right. So we'll talk a little bit about health messengers. I think it's the next couple slides, but just real quick, wanted to go over our virtual classes and what we offer at Special Olympics. We've just noticed virtual classes are pretty successful in being able to reach the state of Montana. We're very large. And so on the screen, you can see our fun photos of Zumba, or we call it, Zumba. So it's on Zoom or Zumba Gold. In the past, we've had 2 instructors that are regularly volunteer their time. We all jump on a call and we move. So it's really fun, and we blast the music and we do some Zumba. So we really want to get those back up and running again. And so this middle one is their dance parties. That's Kelly Harris. She was so fun, and so she offered our dance parties, generally around our holiday happiness challenges. We had a few summer challenges, so she would jump on and be a part of that as well, and we would dance. And so this last one is Cooking with Caitlin. I wasn't around for this one, but this was a demonstration, fun, delicious skillet meal, and it was provided for our athletes, and that was virtual as well, cooking healthy meals. All right, these next 2 are Move Challenge and our Stride Challenge. So we offer these on a regular basis. So our Move Challenge is generally in the springtime and the summertime. The Stride Challenge is during January through March. So these are fun, well-received. We have a lot of family members, caregivers participate as well, unified partners. So really they're just moving every day, and they send me their minutes of exercise, or for the Stride Challenge, they send me their steps of physical activity. Of course, there's competition and leaderboards. So they really look forward to that when they're very competitive. So a lot of them are. So they want to tune in and see, make sure that leaderboard gets posted on Facebook and Instagram. So I enjoy those very much. It's where I really interact with the athletes. So. All right. This is one of our last slides here for the challenges. So we have the Mountain States Eat Well Challenge, Nutrition Challenge, Healthy Habits Hustle. So a lot of our challenges, we move and we exercise. So like I showed you previously, but really wanted to show that we do try to offer on a, throughout the year, some challenges that revolve around nutrition and healthy eating. So the Mountain States Challenge, this focused on mainly nutrition with a little bit of physical activity, hydration components mixed in. We featured a different fruit every week, fruit and vegetable. Each week we included fun recipes for the athletes, workouts, health tips, hydration strategies, and much more. So these are fun too. All right. Let's see, health messenger training. So how do you become a health messenger? So if you don't already know, health messengers is a Special Olympics athlete who has been trained to serve as a health and wellness leader, educator, advocate, and a role model within their Special Olympics communities and the community at large. Stacey, do you want to read these objectives?
Sure. Learn how to build positive health behaviors and be a role model. Learn skills and activities to help others become healthier. Feel empowered and advocate for health needs of people with IDD. And create individual health messenger activation plans and develop a network of health messengers. The only way to end exclusion is to have people who face these challenges daily help create the solutions. People with ID are guiding us towards solutions in our health work. The Special Olympics Health Messengers program was born out of this notion of participation to create more effective public health programs, improve health systems, and engage communities to support the health of people with IDD. People with intellectual disabilities must have leadership roles in the health system.
That's right. So thank you, Stacey. So our health messenger trainings, we really focus on 3 outcomes. So that is empowerment, leadership, and the community impact. So after these trainings, our health messengers are fully equipped to lead their teams, their families, friends, and communities to pursue a healthy lifestyle and to advocate for healthcare providers and governments to adopt inclusive policies around health, the wellness services, education, and resources for people with IDD. And these 3, I just included these 3 because I had the pleasure of training these 3. These 3 at the bottom here are Billings athletes. And so this next year coming up, I will have another one and I will train 3 more athletes. So that takes place in January. So I look forward to that. All right, so that concludes Special Olympics Montana Health, I guess, in a nutshell. But as we close, let me just say that everyone has the right to health. So I'm going to ask Coley to share this story of impact, a story of an individual with an intellectual disability whose life was changed because one healthcare provider who was trained in the care of people with intellectual disabilities and who took the time to treat this patient. So Coley, do you want to tell us the story about James?
Sure. James, a 42-year-old man with Down syndrome, was referred to a Dr. Henry Hood, a dental specialist. James' condition reflected years of neglect for what he had started as routine needs, then became extreme and even life-threatening. By the time James reached this stage, his emergency needs were clearly evident, but no regular dentist was going to take him on this advanced condition with IDD. Dr. Hood took James on as a patient. James needed to have teeth pulled, gums treated, and construction of a complete and partial denture. As you can see in the second photo, James' serious oral disease have been resolved, but the environmental issues that allowed him to get to this stage have not.
Very powerful story. Thank you for sharing that. All right. So our next one, Hillary, what's your last message for everybody?
I want I want to invite you to volunteer with Special Olympics through so many ways, big or small. To get involved, help with the healthy athletes screening, become a coach, or help run a sports event, or just come and cheer our athletes on at a event.
Thanks, Hillary. So yes, not only just volunteering, but so this code right here, actually, this code that I'm sharing, maybe you can scan it from where you're sitting, but probably not. Tried to make it large enough, but so this code brings you to our main resource page. So how to volunteer or how to sign up an athlete, it takes you right there. So if there's any questions about that, you can certainly reach out to me or Vicky. And my last slide here, it has my contact information, but really just wanted to save some time for Q&A. Whoop. Q&A, open up for discussion, because we certainly, I know, gosh, even yesterday and today, we've certainly already built some partnerships. And so we're always willing to learn from you guys and grow our health programming. So if there's any questions for us, but.
So do you work in really rural areas of Montana?
You want to, I think we're all.
That is another great
Okay.
question. I love all your great questions. So in Montana, we're divided by 8 different areas. And so
Okay, yeah.
every part of Montana should be covered by an area. And within each one of those areas is an area management team.
Yeah.
There's an area director, and there's a plethora of little teams. Just depends exactly where that whatever city you're thinking about. But we have contacts in pretty much in all 8 areas, we've got contacts.
Okay. I think is that, because we're in Poplar on the Fort Peck Res, and there's like a name of a group that oversees our area. I can't remember the name of that group right now. But I think I know what you're talking about. But I just know that I was messaging my partner and I was like, I don't think, like, our schools definitely have not had any modifications or any adjustments to any of our track and field days. We got a hold of Montech. I had mentioned that to you earlier, and we got like the trike for her daughter. But aside from that, like, there's no access to like adaptive equipment or different track and field or like activities for the kids. And then she was also telling me that a majority of our practitioners and nurses in our area specifically are not podiatrists, so they're not like, they don't have the training and education to work specifically with like younger people, which is why just there's like a general like lack of, I mean, like there's literally like not really anything happening. So I don't know. Yeah.
A good question. And we can also connect offline and see if we can connect you to Special Olympics at certain sites. Not every school has Special Olympics teams. And we run something what we call Unified Champion Schools, which is actually a curriculum which parallels the actual sporting events too. And I'm not sure if Poplar is involved in a Unified Champion School, so probably not, but let's see if we can connect you to a community-based team.
Great question. And there's my contact information up there as well. I didn't bring any cards with me, but at least included on the slide. But was there any other questions?
I just have a comment. I just want to make connection. My name is Jessie. I'm the the director of the undergraduate food nutrition program at Montana State University. And last year I had connected maybe with you, I don't know, someone in Special Olympics to get our students involved in the programming. But the only opportunity we were offered was summer, and students are gone in summer.
Right.
I run our senior capstone, and I feel like this would be could be incredible capstone opportunities for our senior students. And so I just want to try and make those partnerships. I personally was unaware of like things happening throughout the year. I was only familiar with the state thing. And so now I'm like, oh my gosh, okay, we really should make this happen. and get a group of students in the spring to, do some sort of big project or engagement
Yes,
with athletes.
thank you. And it was Jesse?
Yeah.
I think that was me. And so the only thing at the time was our state summer games. And of course, yeah, that's in the summer. So, but in terms of like our fitness programming throughout the year, that would be awesome. And then inclusive health training. So it'd be great to connect with you offline as well. But
So, and we also have had in the past, senior students come forward to do capstone projects. So we're equipped to do that. If they come forward and propose, they have some kind of a proposal. We've done that in the past and could do that again. And I think here in Missoula, I know the area spring games are usually early May. And then I think it's like our second or third week in May. Then we are down in Billings for the state summer games. And so, but we'll have to even keep you in mind if your team wants to travel to Helena next year for basketball, that will be again in Helena in November. So, all right, but
Great. I'm gonna just really call for a big round of applause. This was fantastic. Thank you for the panel. Thank you for the information. Thank you for the questions and the networking, really raising up just how important the work is that we're doing. It is not everywhere. And so really forming these partnerships and continuing to work together so that the opportunities that some people are creating in some of our communities are available across the state. So thank you so much. We are just going to transition for the next 5 minutes from our breakout session format back to our plenary format and be ready to welcome Chris Bryan, who is with Find Help. So please just make yourselves comfortable, get back to your seats, and in 5 minutes, we will have our next plenary. Big round of applause. Thank you.
thank you, Meg.